Good afternoon. I'm Leslie Foster, and I will be the host for today's show. And on behalf of the Black Women's Health Imperative and Healthy Women, I'm so thankful that you have joined us today to reclaim your wellness. This health series is a commitment by both of these organizations, which are really leading women's health experts to really partner to raise the awareness of the national crisis of obesity as a disease. Now, they recognize that for far too long, people living with obesity have been treated differently than people living with other diseases. So is it important to talk about obesity? Absolutely, but we have to do it without stigma, without bias, without judgment. And with more than 93 million Americans right now, including children affected by obesity, it has been described as an epidemic by the CDC. Obesity, as you know, affects every part of the body. It's associated with diabetes, cardiovascular disease, cancers, liver disease, heart disease, high blood pressure, stroke, you name it, depression, the list goes on. And we are spending $1.4 trillion each year on direct and indirect costs linked to obesity. So this is something that we have to talk about, that we have to mobilize around. And the Black Women's Health Imperative and Healthy Women have developed this Reclaim Your Wellness campaign that's really focused on making obesity a healthcare priority to improve your life, the lives of people living with obesity, the lives of people connected to people living with obesity, and really changing how we see, how we prevent, and how we talk about this lived experience. So we are so excited to have you with us this afternoon to join us for this part of Reclaim Your Wellness. We call this series Obesity is a Disease, Know Your Options. And we're going to talk about those. Now, before I introduce our fabulous panel, I would be remiss if I did not mention a program that you can use right now in conjunction with what we're doing, with all the great options that you're going to hear about today. It is a Black Women's Health Imperative app. It is called CYL Squared. It is short for Change Your Lifestyle, Change Your Life. And this whole app is really a lifestyle change program. It utilizes a CDC-approved curriculum to give you tools, to give you support, to help you replace those unhealthy habits that all of us have had from one time or another, and really replace them all with healthy ones. We can do this in order to prevent type 2 diabetes, to prevent other chronic conditions like heart disease and high blood pressure and high cholesterol. So go to their site and check it out. And let me also let you know that this afternoon is really about you. We have incredible medical experts that are going to provide insight, but they want to also take your questions. So think about those burning questions you've been wanting to ask, share them on YouTube Live, share them on Facebook Live, and we will get them to our panelists after we have a nice conversation to dig a little bit deeper into the options that we have around treating, preventing, and talking about obesity as a disease. So let us introduce our dynamic panel to you today. I get to introduce to you someone who I've met before, Dr. Michael G. Knight, who is an internal medicine physician specializing in obesity and weight management at the George Washington University Medical Faculty Associates. He's also an assistant professor of medicine at the George Washington University School of Medicine and Health Sciences here in Washington, D.C. I'm here as well. So good to see you, Dr. Knight. Dr. Lauren Powell is known as the culinary doctor. She is a board certified family medicine physician and a culinary medicine specialist. And we're going to talk about that because I bet you don't fully know what that is. And it is very interesting and key to helping you on your wellness journey. Dr. Powell, thank you for joining us. Nurse Alice Benjamin, who is known as America's favorite nurse, is also joining us. She is joining us from the West Coast, bright and early. So we are so thankful that she is able to join us today. She is a clinical nurse specialist and a family nurse practitioner. Good to see you. Thank you for being here. And finally, we round out this dynamic group of experts and servants with Karen Howard, who is the Director of Policy and Advocacy at Mental Health of America. Thank you all for being here today and really making some time to help all of us reclaim our wellness, regardless of where we are on our wellness journey. Dr. Knight, I'd love to start with you, because one of the things we've talked about is that for some in the Black and brown community, some women do actually not know that they may be living with this disease that we call obesity. So can we talk a little bit about what obesity is and what people are likely to hear about when they come and see someone like you?
Sure, and thank you for that question, and thank you for including me in this important program. When we talk about obesity, we have to think about the medical definition. And that medical definition is based on what we call the body mass index, or BMI. And above the number of 30, it takes into account your weight and your height. That is what we classify as obesity in the medical space. So sometimes when I say to a patient, or they said, the doctor told me I was obese, but I don't feel obese. We think in our mind with that word, we think of individuals who have hundreds of pounds of excess weight. And so we want to be specific that we're talking about the medical definition. I like to say excess weight. Sometimes we use the term overweight, which also has a medical definition, but people understand what that means. The ultimate issue is that excess weight can be impacting your health, your cardiometabolic health, so cardiovascular disease or heart disease, diabetes, high blood pressure, and a variety of medical conditions are all affected to how excess weight is impacting our bodies. And that's why we know that obesity is a chronic disease. And as a chronic disease, it needs intentional and comprehensive care from your primary care physician, from a physician like myself who's an obesity medicine specialist, or from a number of healthcare providers that are able to address this very important medical condition.
So you have dedicated your life to educating people around the disease of obesity. Mm-hmm. And Dr. Powell, I have to ask you this because I know that for some people, and this is not the case with you, with your own patients, but for some people, they've never had a discussion with their primary care physician before they even get to the point where they would go see a Dr. Knight about their health, about where they are in the circumference of that, and what that means for them. And we've built a lot of conversation around judgment and bias. If you're living with obesity, you eat too much. You need to move away from the table. We don't think about perhaps all of the social determinants of health that may be impacting your journey to living with obesity. Can we talk a little bit about that and how these social determinants have an impact on people living with obesity, particularly in communities of color?
Sure. Yeah. I mean, obesity is not a straightforward thing that is a one-size-fits-all type of a disease. And so we can't talk about really any health condition without talking about things that affect that health condition. So we can't talk about obesity without talking about social determinants of health and things that affect us being able to attain wellness. And so if someone doesn't have access to food, if someone doesn't have access to medical providers like myself or like Dr. Knight, maybe someone that looks like them, if they don't have insurance, then it's hard to kind of address the condition. It's hard to address the disease. And I think really you can see social determinants of health truly at play when you look at children. There have been studies that have shown that children whose are more likely to be obese if they are, a child of a single parent household, if their parent didn't have a college education, if they live in a community where they don't have amenities like gyms and things like that. And so this is a child who, has little say in things, but you can see how just their environment, things that make up their environment affect their health. And so if it's true for children, it's also true for us.
Nurse Alice, you have seen this convergence of people living with obesity and this intersection where we are in a pandemic. And we know that people living with obesity are impacted more significantly and in part disproportionately by COVID-19. Can you talk a little bit about what you've seen in your daily work, trying to save lives and trying to help people who are navigating this space?
Yes, so I work in the ER and ICU setting. So I've been very much on the front line during this COVID pandemic. And what we do know is that people who are obese are at least 3 times more likely to suffer severe complications from COVID-19. They're 5 times more likely to be admitted into the ICU, and partially, and so because the obesity comes with, compromised lung function, because of the extra weight, they've had some type of chronic low-grade inflammation that's been occurring all of this time. And usually they have other medical conditions. It's usually not just obesity. There might be some high blood pressure, diabetes, and all of these things have made it very challenging, even more challenging to take care of them during this pandemic. But, on any given day, of the people that we've been taking care of that have COVID, nearly a third of them that are in my ICU and the ER are people who are obese. So I don't think that people fully understand how important your weight is when it comes to your overall health. I mean, even if you didn't have diabetes or high blood pressure, just having that extra weight on, especially for a prolonged period of times, can impact other parts of the body. And it puts the body at a disadvantage. And especially when you add into the mix something like COVID-19, even more so, your immune system, your body's attacked even further. And so, that's what we're seeing, what's what we've seen and what we're seeing in the hospital now. And I'm hoping that in this conversation, we can really, address many of the things around obesity to help people feel better, look better, and be healthier.
I think one of the things that impacts people living with obesity is their mental health, and we know that during this pandemic, it's been stressful, particularly for Black women who are often head of households, who are in jobs in many cases where they cannot work from home, who are trying to help take care of the kids, who are working really hard to try to maintain their physical health. But this mental health piece is really important too. And so, Karen, I'd love to kind of talk about how during this pandemic, you've seen sort of an uptick in depression and sleep disorders, all of these things which can contribute to the disease of obesity as well.
Sure. Thank you so much for the question. MHA is Mental Health America, is a national organization. We have over 10,000 people coming to our website taking a screening. These screenings cover depression, anxiety, eating disorders, substance use disorders, and that is more than twice of what we saw in 2019. So there's certainly a help-seeking population that's reaching out and looking for resources during COVID. In addition to people realizing that something might be off with them, but being unsure of what to do, whether or not to talk to a physician about it, people are identifying as feeling and experiencing suicidality and isolation and loneliness in great numbers. So we're seeing mental health conditions and people affected at a high rate, as well as youth being most likely to screen positively for anxiety and depression. Childhood obesity is certainly dependent upon a number of factors, which the clinicians on the panel can tell you more about. However, one of those certainly it could be impacted by the relationship that the child has with foods that are healthy, or food in general. Bulimia, anorexia, binge eating are some of the disorders that are related to mental health and that are classified in the DSM-5, however, are related to body image and possibly other emotional damage or trauma. So there's certainly an increase in the kind of people seeking help and realizing that something is off during COVID. And what MHA has done is try to create some resources for the public to help educate them that you're not alone right now. And I try to help families understand that having dedicated time to feel and to just experience the emotions that have come up with COVID, that's really important to our overall health.
This particular disease is fueled by so many things coming at you, right? There's no one thing that that takes you down the path of living with obesity as a disease. But once you know that that is what you are living with, Dr. Knight, and someone is trying to find treatment options, where do they start?
Mm-hmm.
What resources are there?
It's a great point. You know, when we talk about obesity as a disease process, and I know one of the things my patients will come to me, they may get a referral from their primary care doctor, which is often how it happens. You go in for your physical, you're having a conversation with your doctor because there's a new diagnosis of diabetes or high blood pressure. And oftentimes, you know, the doctor will say, well, you need to lose some weight. And unfortunately, that comment without the context of support, of resources, of an action plan can be really detrimental to the patient relationship. Because if you just say you need to lose some weight, and then I'll say, well, doc, I've been trying, or I know that, how can I do it? And if the response is eat less and exercise more, we know that anyone who's dealing with excess weight understands that it's a lot more complex than that. So many times you start with a conversation with your doctor, and if that doctor does not feel comfortable or does not have the knowledge to develop a comprehensive plan, then they will often refer you to someone who does have that specialty of interest. Sometimes it's an obesity medicine physician, endocrinologist, or someone who has special training in this, such as nutrition, like our culinary doctor, Dr. Lauren. In addition to that, thinking about how do you think about any complications, comorbidities. We're not just looking at BMI, and a lot of people say this, it's not just based on BMI. BMI is only the first step in classifying someone as having excess weight. And if we only rely on it, that's where the problem is. So we need a comprehensive approach, and you can access that by talking to your healthcare professional.
I want to drill down a little bit more on the BMI, because I've often heard that the BMI can be misleading, particularly for Black women. Mm-hmm. And so if that is your benchmark, and the only benchmark that your doctor is using to make a decision about whether you are living with obesity or not, it's almost like you could have folks that aren't included that need to be, or folks that are included that maybe aren't truly fitting that journey that we're talking about with respect to obesity, because it sounds like there's a bit of a pendulum with that as well, right? Yeah. There's the I gained 10 to 15 pounds during a pandemic, right, which is real, and then there's what you seem to be describing, which when you say excess weight, what are you talking about?
Mm-hmm, mm-hmm. I'm talking about weight that is causing difficulty, either health-wise, that's impacting your cardiometabolic risk. When we talk about BMI is a tool that's often incorrectly used, right? So it's not just supposed to be the be-all, end-all. It's telling me, let's look further into this. Maybe the patient has a lot more muscle mass. Where is the patient carrying that weight? We know that weight that's carried in the thigh region, for example, which many African-American women do, is not as detrimental as weight that's carried in the central region. And so I'm having a conversation with the patient. I'm examining them. Where are they carrying the weight and how much is there? Then I'm also considering, do they have diabetes? Do they have high blood pressure? So if a patient just is higher on the BMI but has no comorbidities, is carrying the weight in an appropriate way and it's not impacting their health, that's a totally different conversation. So you really have to push farther than that. And again, if you're not getting that from your primary care physician, ask him or her for a referral, or look on to getting in with someone who has training in this area that can have a full comprehensive conversation with you around what excess weight really is and how you can address it.
Food is not everything on the journey that you navigate if you're living with obesity as a disease, but it is part of the discussion and part of the journey. And so, Dr. Powell, I'd love it if you could talk to us a little bit more about what is a culinary doctor, and what specifically are you helping your patients do with that additional expertise?
So culinary medicine is basically a study of medicine that's taking into account somebody's health condition and teaching them how to cook with respect to that. So obesity and health, a lot of things that kind of go into optimizing that. Food is a big part of that. And so I'm going to talk about what are you eating and what are you cooking and how are you cooking it in every one of my visits.
So I think it's interesting to talk about how you got on this journey yourself. Your father had a chronic health situation, really an emergency, and it caused you to sort of stop in your tracks to help him live his best life. And let's talk a little bit about that.
Yeah, so when I was in my last year of residency, I was talking to my dad on the phone after getting off a 36-hour call, and his speech was slurred, and I recognized that he was literally having a stroke while we were on the phone. And so at that point, called my mom and got him to the hospital, and was diagnosed with new onset diabetes. Blood pressure was very difficult to control. Cholesterol was so high, it couldn't even give us a number. It just said high, his readings. And so for me, that kind of changed a lot about what I thought in medicine and valued in medicine. My father was not a neglectful patient. He was going to the doctors every 3 months. He was taking a bunch of medications every day. And so I thought, if a patient can do all the things that they're told to do by their doctor, but something still happens, maybe we're missing something. Maybe we're not telling them all the stuff. And the same was happening for me in training. I mean, I was taking care of patients in the clinic, but then I was admitting them to the hospital when they had a stroke or a heart attack or DKA, and so that's when I really thought, we have these medications, which are amazing, and they help us so much, and they definitely have a place in medicine and in our health. But we really have to get to some of the root causes of why disease happens to begin with. I know that I can lower your blood pressure with medication. I know I can lower your blood sugar with medication, but why is your blood pressure high to begin with? Like, why is your blood sugar high to begin with? And so part of getting to the root cause of the disease is talking to people about what they're eating and what they're putting in their body and how they're preparing it. Oftentimes the reason we're seeing conditions in entire families is because people are eating and cooking the same way.
I was going to say, if you are a parent or head of household living with obesity, the chance that your family is on that same journey is very high, based on what I'm hearing all of you say. Nurse Alice, you have shared a rather personal experience. You have navigated this journey yourself and have had to make some pretty significant changes to ensure that you're able to not just survive, but thrive. And it sounds like that is a tough thing for healthcare professionals, because we know that according to a recent study, healthcare workers are at a much higher risk of obesity than the majority of occupations. Can you tell us about your journey and what you know from your own experience about that lived experience, right?
Yes. So one thing I think it's important for people to know is, although we are healthcare professionals, we are still human. So we are not immune from any of the diseases in which we treat or diseases or that we help our patients get through. We ourselves have many of the same journeys that our patients have. And I just recall a certain point in my life, I was 185 pounds. I was like a size 16, 18. I was jumping to put my clothes on, holding, sucking my breath in. And I was very fatigued. I was going to my healthcare provider. I was borderline diabetic. I was borderline hypertensive. And I was just busy raising kids and working and just going, caring for others and not stopping to take care of myself. But I remember the conversation going into my doctor's office one day. He said, "Alice, you are a nurse. You are here to take care of the people, but you will not be able to take care of anyone if you don't stop and take care of yourself." And, I have diabetes and high blood pressure on both sides of my family. As Dr. Lauren mentioned, a lot of the customs are a culture. We celebrate around food. What my parents grew up eating and cooking, I'm going to do. Their activity levels, I'm probably going to adopt those same things. And that's really what happened. But I started this journey. I said, you know what? I had to find out what my why was. My why was my family. I wanted to be here for my family. And so I'll be honest, the first thing I did was change what I ate. When I actually did a diary and was looking at what I was eating, when I was eating, because also it's not just what you're eating, but how much of it that you're eating, the time in which you're eating it. And, I wasn't even exercising, but I have to say a majority of my weight loss, I wish this would happen for everyone, but it kind of melted a little bit once I just changed what I ate. I started reading labels. I started looking at plates and you have a plate, but your plate is not a mountain. It should not be a mountain of food. Looking at small things like dressings and additives to my salad. I think I'm eating healthy, but my salad got all this thick Thousand Island dressing. I got all of these other things in it. And I really just took a look at what I was eating, reading labels, looking at portion sizes, the timing of my eating, limiting my eating, so it's not right before bedtime, looked at cholesterol, salt, all these things. I just started to educate myself and make a simple change because you eat already. So that's an easy tweak. The harder part was to add the exercise, because if you don't already exercise, adding that to the regimen was more challenging. But I have to say, once I started to eat better and I started to lose weight, I started to feel better. And it kind of all was connected mentally, because I had some depression when I was obese. I was obese. I think my BMI at the time was 32, although that's not the only indicator, I know. But, I think once you start to eat to live, and that can really be a game changer. It clears up it cleared up my mentation. I had more energy. My skin was clear. My edges were there. Like, I was just feeling so much better about a lot of things in life. And all of my other metrics, my blood sugar, my high blood pressure, all of those things started to come back into a normal range. And once I saw kind of that change, it inspired me and motivated me to continue to do more. So then I added exercises, I added, counseling, because it's also, you got to have a good support system in all of this too. I think it was mentioned earlier that you have to have a plan, you have to have a support group, you have to have things in place to help you be successful. And that's what led me to my journey now. And I'm ranging in the mid 130s, and I'm happy about that. But I dropped 50 pounds, and that made a big difference in my health.
Wow, that's amazing. And congratulations for being able to recognize, while you still had time to make the changes, so that you weren't just surviving, that you were thriving. One of the things that I've been hearing everyone talk about, in addition to the things that can contribute to the disease of obesity, the food that you may be eating, the profession that you have, is sleep. And Karen, a lot of people are losing sleep during this pandemic, and the loss of sleep and the body not having a chance to regenerate has a huge impact on your body's ability to process food, to deal with stress, to deal with all of the things that contribute to living with obesity. And of course, during this pandemic, there's a great deal of stress that is beyond our control. And so I'm wondering, what kinds of things can people be doing to help with that sleep part of what could contribute to the disease of obesity?
Sure. This is a very timely question, as I did not get very good rest last night. However, I typically am a good sleeper. I can pretty much knock out wherever I am. My mom even, I think, was diagnosed with mild narcolepsy, when I was a child. So sleeping is usually not an issue. However, I think over time, since we're at the 1-year mark of the pandemic, I've been doing some reflecting on where I was this time last year, and how things have just so significantly changed in terms of my connection to community, the relationships that I'm maintaining, how I'm really forced to spend so much more time on screen in front of that blue light that, tells our body to go, 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 and typically does not allow us to go right to sleep. These are, I think all, like you said, contributors to rest and, the quality of rest that we get. So some of the things that I promote and do myself is, I schedule screen time off. So by a certain time, my phone is on do not disturb. It's, put away, sometimes on airplane mode by a certain time every night. And I think it's really important to, hold yourself accountable to getting off screen, whether it's your laptop, your phone, your tablet, iPad, whatever it is. Another thing that you can do to protect your sleep is to keep those devices outside of the bedroom. So, if you do have, TV and other devices that are on, turn them off by a certain time or remove them completely. Make sure you're not putting your work laptop or your work, devices in the bedroom. Your bedroom can be considered a sanctuary or retreat area where you really just use that time to mellow out and rest and relax. I really like the term compartmentalization here. I like to compartmentalize where I relax and meditate and pray and encourage, letting go of stressors versus, where I allow stress to possibly build up. And a lot of us carry our stress in our body somewhere. So it's also important to incorporate physical activity up to 30 minutes a day. There is a mind-gut connection. So mental health conditions and your brain health is impacted when your food is nutritious and you're eating lots of greens and fresh produce and vegetables. As well as when you can get up to 30 minutes of exercise a day. And it doesn't have to be all at one time. It can be 10 minutes here and 10 minutes there of jumping jacks or running up the stairs 2 or 3 times, or just walking around your home. If you're fortunate enough to live in a home, I live in a building with like 200 units here. So it's a large enough parking lot that when I walk around, that's 2/10 of a mile. If I do that 3 or 4 times, I'm getting some exercise in. And then especially for parents or mothers with children, I would say schedule alone time. It's really important to have that. Even if you have, toddlers or little ones, try to build a support system in your neighbors or within your circle of trust during COVID that allows you, at least 15 or 20 minutes of just alone time every day. So those are some of the things that I think can contribute to healthy sleeping, reducing anxiety and stress, and also getting out of the habit of shaming ourselves for doing something wrong. We're human. We're going through a very difficult time together. And so just, keeping in mind the compassion and forgiveness that you might have for yourself during this time, I think is really important.
Those are all great things and all things we can be doing, regardless if there is a pandemic and this kind of outward stress. That's the kind of thing we do to prevent the stress from occurring, for sure. Dr. Knight, I know that we've talked about food, we've talked about stress, we've talked about the impact of this pandemic, our mental health, but there are still going to be some for whom they're going to need a different kind of intervention and innovation. And I know when we do these kinds of talks, people are always wondering about what are the newest innovations in anti-obesity medications? How do I determine if I'm eligible? How do I learn about these kinds of things? What would you say to them?
Sure. So I think it's so important that we look at the comprehensive treatment strategy for obesity. And as many of you all know, you can go down to the molecular level. There are various hormones, such as ghrelin, such as leptin, such as many others that actually regulate our weight. So it's not simply putting food in my mouth or how active I am. That's a huge part of it. But there are other factors. For example, many individuals who have excess weight, they may eat less than their friends who weigh a lot less than them. And they say, well, I don't understand why food is reacting this way to me. A lot of times there's hormonal dysregulation. A lot of that has to do with sleep. Some of it has to do with anxiety, stressors, genetic factors, and a variety of issues. So when we think about how do we treat that, the foundation for my practice is always diet and physical activity. But in addition to that, I may use medications. Some patients may have surgical options that help them to address those issues and help them to make the changes. For example, if I'm speaking with a patient, they have cravings all through the day, their portion sizes are too large, and I will tell them, we need to reduce the portion sizes by 20%. And they'll say, Doc, I can do that, but I feel like I am starving. I'm so hungry. It's not something, most of us who don't have excess weight, we eat until we feel full. It's not that people are eating till they're full and then they're eating more than that. Some people do that, but the majority of people, what makes them feel full is different. And so when we think about medications, there are FDA approved medications. Some examples are liraglutide and a variety of others that you can talk to your healthcare professional about that help to take off some of that appetite control, or help you with appetite control, and help you to stick to a dietary plan that's already been prescribed by your physician or by a registered dietitian. There's also surgical options for individuals, oftentimes who have a larger amount of excess weight to lose. Can you lose 100 pounds by yourself by making changes in the diet? Of course you can. But for many people, it's extremely difficult, particularly when they have to lose more than 100 pounds to get to a healthy weight for them. And that's oftentimes where we see surgical, bariatric surgery, gastric sleeve, and a variety of other options that will be helpful for patients. But again, there's no one intervention that works for someone else that may work for you. You have to talk to a healthcare professional that can help put it together so that you can get to the healthy weight for you, not based on BMI, but based on what your body needs.
I'd also love to just add in that for people with mental health conditions who are or are not taking medications, for certain conditions, for instance, schizophrenia, there's an increased linkage to diabetes. There are some treatments and the medication side effects are a big increase in weight. So you may have put on 20, 30 or more pounds simply by starting a medication to help with one condition, but then it leads you to become obese. So there, is oftentimes some other things at play that consumers just should be aware of as well.
With the 4 minutes that we have left before we start taking questions, I wonder, Dr. Powell and Nurse Alice, and Karen, you can weigh in here too, because I think Dr. Knight sort of teed us up here. What are we putting in our toolbox to kind of live our best life to ensure that obesity is not a disease that we have to live with? Or if we are on that journey, what we can do to kind of, in our own power, to hopefully redirect that?
Sure. So I think number one, it's great to have a primary care physician. It's great to have someone that you have a relationship with that you see regularly, because again, like Dr. Knight said previously, some people don't have a lot of insight into their health. They may not know that they're classified as obese because they're not going to the doctor and getting some of those measurements done. So having a good relationship with your doctor is important. Don't wait until there's a fire, to establish one, being as preventive as possible. I always talk to my patients about trying to cook their foods. Even if you eat the same food that you're going to get from a restaurant, if you cook it, you're more likely to use less salt and less sugar and have smaller portions. So cooking our food is important. It's also how our kids learn how to cook. I mean, they're not learning this stuff in school anymore. And so if we don't cook, oftentimes our kids don't learn. And so we're kind of setting them up for a life of fast food. So cooking our food, teaching our kids how to cook, reading labels like like Nurse Alice said is super, super important. Trying to if you see words that you don't recognize, you probably shouldn't eat it. I always tell my patients, for example, a Twinkie has like 17 ingredients in them. Most of them you probably don't even know what they are. So that's not something you want to be putting in your body every day. I think those are a good place to start. I'll let Nurse Alice give some more.
Well, for me, I mean, because of also my very personal experience with having to lose weight, I think one of the things that we can do is start today. Start with your family. Start talking about what your goals are as a family. I mean, we all love each other. We want each other to stick around. We're worried about COVID. That's, getting that infection and dying from that. But what about the things that we can control, which, is our weight? Now, I know there are lots of barriers. As we mentioned, there are medications, there are external factors. Lots of things can play a role into why someone is obese. But let's talk to our family. So with my children, Dr. Dorn, you'll be very proud of me. We read labels together in the grocery store. I'll say, okay, you guys want cereal? Let's look at these labels. Cooking together. Let's look at our portion sizes, and let's be kind about how we talk to one another. I grew up in the era of don't waste any food. There's somebody who's starving. You got to eat all that. We should not be doing that to our families today. And it's so, because we shouldn't operate with that scarcity mentality. So if someone can't finish the food that's on their plate, okay, well, good, let's package that up. Maybe you can have it later instead of making them eat it now. I know also in the Black community, we use food, whether it's the repast, whether it's the wedding, we're all celebrating. There's always going to be food. But let's look at grandma's recipe. I know we love her greens and the ham hocks, but can we do it this year with some, smoked turkey or something, a little tweak? But I think, we got to address our cultures and our customs and the things that we do in our home, because how I eat, my lifestyle behaviors will pass on to my children, will pass on to their children. And so if we want to make a change, then it needs to start today.
And Karen, you want to round it
Yeah,
out?
I'll wrap it up really quickly and just remind people that there is oftentimes there can be trauma related to how you're eating, in addition to the cultural customs that you're used to and what's passed down in your household. There may be a relationship with food based on how you feel. And so I encourage everyone, regardless of whether or not you're obese, to think about your relationship with food, because on the other side, you could have a body image issue that's manifesting because of something else that may have happened in childhood or earlier on. There's sexual trauma, there's abuse, physical, mental, emotional, and all of these other things that could trigger us to have a reaction that relates to our food and our relationship with food. So as you're doing all of these taking clinical steps, also think about the emotional steps you can take to get through into a place where you're feeling more supported. And sometimes that means therapy.
All good advice. Very good advice. And I want to thank all of you for sharing your time today. This is the point in the program where we open this up to all of the people who have joined us this afternoon and have burning questions for all of you about this disease called obesity. And I like that we're very deliberate in how we are speaking, because what I learned about obesity is you've got to speak it. You've got to talk about it in ways that are free of bias and judgment and stigma, so that people feel empowered to get the help they need, to educate themselves, to seek out resources that can make their lives better. So this is my cue to our team behind the scenes, because I know we have been working to populate some of the questions that you have about this journey. And we're going to start with Carol Fleming, who says, no one talks about inflammation. Can weight loss alone decrease inflammation? Dr. Knight, what say you?
Yes, so weight loss has a huge impact on decreasing inflammation. Now, understanding that many things can cause inflammation. There are certain foods that we eat, certain categories of foods that can increase inflammation. Some of our stress release hormones can start cycles that do that. But oftentimes what we know is that excess weight, we call it adipose tissue. So that excess fat mass that is being carried, particularly if it's carried in the central region around the belly button area of the body, it is linked to increased levels of inflammation. And we know that's directly correlated to increased risk for things like cardiovascular disease, including stroke and heart disease.
We've talked a lot about food. And as we're thinking tactically about helping people on this journey, are there things, Dr. Powell, Nurse Alice, that are metabolism boosters, that are like going to slay your metabolism into getting it revved up, moving things out so that you can move the right things in?
Oh, I think Dr. Lauren, I got to take notes from Dr. Lauren on this. She's the expert here.
Well, I mean, instead of metabolism boosting, I really like to talk more about nutrient dense foods. And so that I say is like winning the game. That's like getting the Versace dress at TJ Maxx, right? That's like winning the game. So nutrient dense foods are foods that have lots of nutrition, lots of fiber, lots of vitamins, lots of minerals, but for a very small amount of calories. And so that's winning the game. You're supplying your body with all this wonderful, amazing stuff, but it didn't cost you a lot of calories in order to do it. So one way I suggest people do that is eating a raw meal. I'm all about one raw meal a day. And so I'll have a salad with every vegetable I have in my refrigerator, cucumbers, tomatoes, and beets, and all these things that are super low in calorie, but very, very nutritious.
Nurse Alice, do you have some thoughts?
Well, I'm a student of Dr. Lauren in this, because she is the culinary doctor. I mean, she has this wonderful book that I've read inside and out. But I agree with her. Eating, and I'll say this, many of us, it's not that hard to add a salad to our meal every day. And I like to focus on all the things I can eat instead of thinking about, oh, I can't have this, I can't have that, because it's a mental thing. You always want what you can't have, right? So let's focus on the things that we can have. And I think part of that is I've definitely incorporated that in what I do with myself and my children, and I share that with everyone that I know, but definitely incorporating that salad and something that's very minor, but to me, one small change every day, over weeks, over months, over years makes a big difference. So instead of that, very thick, rich salad dressing, you can make your own. You can squeeze some lemon, some olive oil, some pepper. It's time that we get creative in the kitchen. If we make our own foods, we're more likely to eat healthier things.
One of the things we didn't really get to talk about is a lot of people who may be tuning in now are living in areas where there may be food deserts, or they may have to go longer distances to get to places. They may have to work harder to get healthy foods. How do we help folks who don't have a grocery store close to them really navigate this journey a little bit easier so that they don't end up having to go see Dr. Knight? And Dr. Knight, this is not to disparage you at all. You're here, right? Because we know that this is an important journey and people want to survive and they want to thrive. And so in some cases, people will need to see you. But ultimately, we're trying to keep people out of the doctor's office, right? We want to keep them out of the office so that they're empowered in different ways.
So food deserts are defined as not having access to affordable and healthy food. So it has to be both. So sometimes you can have areas where there is food, but it's just not affordable. And so in urban settings, that's characterized by 1 mile. So if you have to travel more than 1 mile to find healthy, affordable food, that urban area is then defined as a food desert. If you're in more of a rural area, having to travel more than 10 miles would be defined as being in a food desert. If you have to go more than 10 miles to get healthy food that is affordable. And so one thing, whenever I talk to physicians, I charge them with is, if whatever community you're serving, you need to know what resources are available to serve your patients. So knowing what food banks are available, I know if my patients can't get food, I know what services are available where they can get, fruits and vegetables shipped to them. I know where they can get inexpensive fruits and vegetables. And so really knowing what resources are available, food banks are really great for this, and farmers markets as well.
I'm glad you mentioned that. I did a story several years ago about a physician in the DC area who literally was writing prescriptions for food. He was sending his patients to food banks because he knew that this was impacting the entire family. There's another question coming from Deja Love. And Dr. Knight, we talked about this, but everybody wants to dig in a little bit deeper about BMI as a measure, and whether it's biased or not inclusive or reflective of other robust health measures, which is why all of you have said it is one data point, but it shouldn't be the final one.
Right. BMI is a tool that's often used incorrectly because it's limited. Again, it does not account for muscle mass. It does not account for where you're carrying the weight. It does not account for the effect that the weight may or may not be having on comorbid conditions. So physicians, healthcare practitioners should have many other options. It's just a starting point. So if that's the be all end all, then take it with a grain of salt. Let's move on. There's also ethnic differences in how BMI is associated with comorbid conditions. For example, we know women of African descent oftentimes do not see that link to comorbid conditions until they're above a BMI of 30, whereas some women of Asian descent, for example, it's even less than 25. So you have to think about the ethnic origin. You have to think about where someone's carrying their weight. It's just a starting point. So that's very important to understand.
Karen, you know a little bit about this journey. Tell us a little bit about it and what you want to share.
Yes, thank you, Leslie. So I will say that I come from a family of larger people. Both my parents are from rural Alabama. One of my grandfathers was almost 7 feet tall. And so very early on, I started getting messages from my pediatrician that I was bigger, I was over, I was, not on the scale, not the norm. And so I will say that as you and your family are receiving these messages from professionals, do take in mind that as African American men and women, we do not necessarily fit the typical norm for what others have created on these health scales. So I think by age 8 years old, I was already wearing like Mrs. clothes and So, you know, for me, I had to understand that, okay, I'm bigger than, I'm larger than. That doesn't necessarily mean that that's a bad thing. And I had to kind of tweak how I was thinking about it from shame to being empowered and to really embodying what I thought health was. And so for me, health means a lot of raw foods, vegetables. When you think about shopping in the grocery store, it's around the brim. And when you're living in a food desert, it means stockpiling when you have the opportunity. So I did used to live in a food desert in a city, and I would go do kind of shopping in bulk, prepare several 4 or 5 meals in a weekend, and then freeze them and use them as leftovers during the week. So for me, that was one of the ways that I kind of overcame, oh, I'm eating too much or I'm too big, but I also don't know how quickly I'll be able to get to the grocery store next time.
That's a great tactical answer to help with that as well. And something that all of us can do, whether you live in a food desert or not. We're so busy. And Dr. Lauren talks about, you know, really wanting people to cook their food. Nurse Alice, Karen, Dr. Knight, you talk about this as well. And that may be one way to help us on the journey, to do that batch cooking on the weekend, to freeze it. And that way you can take it out so you're not having to do that last minute fast food run. D. Michelle wants to know, she says, my cardiologist insists that I have bariatric surgery. Dr. Knight, this one's going to be for you. I'm reticent to have another abdominal surgery. So she's already had one. That's one data point. Is bariatric surgery the only way to lose more than 100 pounds?
And the answer is no. So there's no one way to lose weight or to lose a large amount. Now, there are ways that are more likely to give you that effect. So yes, of all of the options, bariatric surgery is probably the one that has the highest percentage chance that you will be able to achieve 100 pounds weight loss. I have patients who achieve 100 pounds of weight loss just by changing their diet with physical activity. I have patients who've lost over 100 pounds with the addition of medications. And then I have those that have had surgery. So there should never be one option. And again, it's a relationship. So your cardiologist may be telling you this, you thank your cardiologist, and you involve other people in the same. Maybe say, you know what, I want to dive deeper into this. Maybe I should see an obesity medicine specialist. Maybe I want to meet with a dietitian. Let me go back to my primary care. Look at all of your options before making a decision. It is a decision. It is effective. Bariatric surgery is effective, but it's not for everyone. And so thinking about what you need to get the health and get to the place that's going to be most effective and safe for you is most important.
I think we've got another question. This is from Barb Sykes. She says, are there good books for people to read and inform themselves on how to live healthier? Who wants to take that?
I have a book. It's called Food Essentials for the Busy Professional. And it basically, there's Alice has it. Thanks. I don't even have it in my own office, but it's just a good, simple resource of how we can be healthier with food. So how am I supposed to be healthy if it's 10 o'clock at night and the only thing open is fast food? Or how am I supposed to be healthy if I'm on a budget? You know, so it answers all these food questions that oftentimes I don't have enough time to talk to my patients about in the office. And so it's a simple, very easy to read text. I think all of us, Dr. Knight, Nurse Alice, we all have wonderful things on our social media that's just easy to read, easy to digest health tips as well.
Do we take for granted that a lot of us didn't actually learn how to eat? When I say eat, I mean sort of balanced eating. There are a lot of people who say they maybe didn't quite learn what a balanced meal looks like. And that has shifted so much through the years with the food pyramid that the government has set aside, right? Eat this many carbs, this many vegetables, this much fruit. It seems like there's really this renewed push now to really help educate people about what a balanced meal looks like, what it should look like for you, and what that should feel like for you as well.
Yeah, Leslie, I think when you say that, specifically what it looks like for you is so important. Yeah. When we think about a patient with diabetes, they can't have a diet that is full of carbohydrates or processed carbohydrates, whereas someone else may be able to indulge in that sweet treat after their meal and it has no impact on their health. So thinking about their health conditions, one piece I want to quickly throw in here because I never miss an opportunity is not only talking about food deserts, but food swamps. What's a food swamp? When you are surrounded by poor, nutritious food that is easily accessible and affordable. That's a huge thing to add. So it's not just that I have to go far to find healthy food, but it's that I can go across the street and find something that's affordable, but unfortunately has poor nutritious quality. And unfortunately, our communities have been targeted and impacted by a large amount of this low nutrition food that's readily accessible. So we're not only looking for healthy food, but we also need to avoid some of those choices that are right in front of us.
We have time maybe for one last question.
I wanted to just share one thing about the last question, that people have access to so much advertisement on television and so much information about what looks good and what feels good. I wanted to also just encourage people to use information from the CDC and the NIH websites. These are public health agencies that put out guidelines and information that is reputable. It's not always 100% correct, but it will definitely give you a better sense of what healthy foods we should focus on. Sorry, Leslie.
Oh, no problem. We've got one last question, and this one is for Dr. Knight. And the question is, when diet and food don't work, can you talk about the continuum of care?
Yeah, and I like to see it as when you need additional assistance, when the approach that you are taking to try to control your intake and get your physical activity is not resulting in the weight loss that you need, we have to consider different options. So diet and exercise are always going to be a part of it. We don't have a magic pill. We don't have a magic surgery, but we do have medication options. We do have surgical options, procedural options that can help you to either limit your intake, increase your activity, change the type of food that you're eating, and then take off that heavy appetite, those cravings that often give people a challenge. So food and exercise are always central to this, but there are so many other options, including medications and surgery for the right patient to help them achieve their goals.
Leslie, if I could just add on to there, and something that I found very helpful in my journey, sleep. Sometimes we're not getting an adequate rest. And as Dr. Knight mentioned earlier, you have certain neurotransmitters or the hormones leptin and ghrelin that really help regulate how hungry you are, if you feel full. Those can be regulated by making sure you're getting adequate sleep. That also can help decrease inflammation. And then as well as our emotions. When we're stressed, under anxiety, we have that spike in cortisol. That cortisol makes it a lot harder for us to keep the weight off. So I think even dialing back to, am I getting enough sleep? How am I managing my emotions? I can't control you, but I can control how I respond. And I think just getting back to some of those basics that are definitely within your locus of control can actually help. Even if it's not going to start your weight loss, even if it's going to help only 2-5%, I'll take that if I'm trying to lose weight. Every little tool that I can put in my toolkit, I want to use. So adding sleep and managing those emotions are going to be also key in that weight loss journey.
Fantastic. I want to thank all of you, Dr. Knight, Dr. Powell, Nurse Alice, Karen. Thank you all for sharing your personal stories. Thank you for sharing your expertise. Thank you for sharing your heart. And thank you for your servant leadership wherever you are. You are making a difference, and we are so grateful. I have learned a lot today. I sure hope you have learned a lot today. Hopefully you have taken away some new tools to put in your own personal toolbox to help with weight management and living. And by the way, living with obesity involves understanding your resources and understanding alternatives. And just like with any other disease, we've got to sometimes try some different approaches to find out what's going to work best for us. And of course, with obesity, as you heard from our experts today, it's going to be a combination of tactics that work best for you. And so that is what makes this Black Women's Health Imperative CYL Squared app so appealing. You can use it in conjunction with the other things that you're doing. And so on behalf of all of us here, our phenomenal panel of the Black Women's Health Imperative, of Healthy Women, and of our sponsor, Novo Nordisk, we thank you for being very much a part of reclaiming your wellness this afternoon. We hope that you will reclaim it for life and take those little baby steps that each of our experts have shared with you to transform your life. So visit reclaimyourwellness.org. You can sign up there to be notified of any future events. And most importantly, we hope you have an amazing day. Thanks for joining us.
Thanks.
Thank you, everyone.